Good morning and welcome everyone to this first all stakeholder meeting of 2021. I'm Adam Willoughby and I serve as the Assistant Director for Legislation and Public Affairs here at the California Department of Aging. Before we begin, I'd like to provide a quick overview of the agenda and a few housekeeping items. We have a very full agenda today. First, we'll hear from CDA Director Kim McCoy-Wade on COVID-19 response and vaccine activities. Then we'll hear from State Long-Term Care Ombudsman Joe Rodriguez regarding the work of state and local ombudsmen and the recently released annual report. We'll then hear from Irene Walela, Deputy Director of CDA's Long-Term Care and Aging Services Division, and Chief Deputy Director Mark Beckley on some more specific COVID response work and initiatives. Next, we'll hear from Master Plan for Aging Project Director Amanda Lawrence on the recently released Master Plan for Aging. Then we'll hear from CDA's Deputy Director of Administration, Thomas Cameron, on the governor's budget and some additional departmental updates, followed with a question and answer portion, then a closing by Director McCoy-Wade. Attendees will be muted during this presentation to reduce background noise. And this entire presentation, along with captions and the slide deck, will be made available afterwards on CDA's YouTube page and social media accounts. During the question and answer portion, you can use the raise hand icon to request your line be unmuted, or you can use the question and answer icon at the bottom of your screen to submit your written question. We will get to as many questions as we can in the time allotted. If we're not able to get to your question, you may always email questions to olpa, O-L-P-A, @aging.ca.gov. So thank you again, everyone, for joining us this morning. And at this time, I will go ahead and hand it over to CDA Director Kim McCoy-Wade.
Good morning, all. It's good to be with you in the new year in every sense. We want to start, as we unfortunately must still start with, is the COVID response. Again, we are working deeply in partnership with the entire Health and Human Service Agency family and so many of you on this, but just to make sure we're all have the latest and greatest and not so great. We're going to be looking at data really quickly, taking a moment to as our new president did and new vice president did, to remember lives lost, and turning to vaccines briefly. Next slide, please. As a reminder, the data continues to be particularly devastating for older adults, particularly when you look at deaths. I will summarize this chart briefly. On your left, you see positive cases by age. And there's blue bars that show the number of cases. There are vertical lines that show the population share. So you can see that 18 to 49 has the largest number of cases, adults 18 to 49, exceeding their share of the population. But if you look at the chart to the right, total deaths by age, you can see that overwhelmingly the largest bar is 65 and over. 74.8% of deaths, 75% of deaths, and again, dramatically exceeding this percent of the population. So I know this is a number and an experience felt by so many of us professionally and personally. And so that, of course, is driving so much of our COVID response. Next slide, please. Equally important is the disparities that are occurring due to the legacy of racial discrimination across different racial and ethnic groups. If you look again, the same two charts, cases and deaths, but on the left, positive cases by ethnicity, you see that the largest bar by far is among Latinos, 54.9%, again, exceeding the percent of the population, the share of the population. And if you look at the chart to the right, total deaths by ethnicity, you see that Latino again is the largest bar and again is exceeding the percent of the population of 46.2%. So particularly a high hit. Other populations worth speaking to are African American or Black population. The death rate has been disproportionate. Again, you might want to look over at the case rate and see that the death rate is higher than the case rate. and then some Asian and Pacific Islander, which unfortunately we're having challenges disaggregating from the broader API community. So with that lens, next slide, we of course have had a just unprecedented amount of deaths, and we have started the new year. I want to remind you that CDA has had for many months an in memoriam page, both with these numbers, tracking each and every life lost in California. And also below this, you'll find links to various coverage of lives lost that LA Times and others have done to really lift up each and every painful loss to family and friends. And then we were honored and gratified, next slide please, to see the new president and vice president taking a national moment for grief. And just if you weren't able to participate on Tuesday, I would encourage you to take a moment and watch it. It's about 10 minutes and it's quite moving, if I may say. So appreciate this opportunity for a moment of unity and remembrance. It has been certainly a long year and we have more to come. The good news is, next slide, there is hope on the horizon, and part of that hope is that the vaccines are here. I want to thank our Department of Public Health colleagues and many of you who are on the Community Vaccine Advisory Committee working on this. Quick updates. I think everyone has seen the policy announcement that people 65 or over are now eligible to receive the vaccine in California that the governor made on the heels of the CDC announcement about 2 weeks ago. There are two challenges that everyone is working on. One is local logistics, opening up more access points with county public health, local health systems. You see these mass sites happening at Dodger Stadium and soon Cal Expo. So the local logistics are getting better every day. More than 30 counties, the last time I saw, are doing older adults in some level. But of course, the other big challenge is national, and that's our national supply. And so looking forward to hearing more from the new federal administration about the forecast for supply. And then lastly, I'll say we are continuing to look at one more thing on vaccines, on outreach and communications. And we are very excited to have talked with many of you in the governor's office on Tuesday about ways to do outreach and partnership. And thank you to AARP for offering some support and partnership, and meeting with the Commission on Aging on Friday. So lots to do to spread the word that vaccines are safe and free, and that we can address people's questions and concerns about vaccines. Okay, but last but not least, the most important thing, even while vaccine rollout is happening and we hope accelerating, we all still need to stay safe. And that largely means wearing a mask, staying 6 feet apart, and staying at home. So hoping that all are recommitting to this as we see the numbers just beginning to plateau a little after the terrible surge around the holidays. And thank everyone for all their work to do this, and all your services that allow consumers to do this, and hope we can stand together to keep all of us safe. So with that, that's the update on COVID. I want to hand it over because there is so much more to come from our program response. And Adam, I'll hand it back to you to take us where we're going next.
Great, thank you so much, Kim. Next, we are going to hear from State Long-Term Care Ombudsman Joseph Rodriguez. Joe.
Thank you, Adam. Good morning, everyone. I'd like to talk to you today about services that the Ombudsman program has been providing to residents of long-term care facilities, and to highlight our annual report, which we just released for federal fiscal year 2019. Next slide, please. As you can see, the long-term care Ombudsman program has had to re-enter facilities in a very safe, thoughtful manner. Back in June, we issued our first guidance to local ombudsman programs on facility re-entry. It's been updated several times since then, most recently in September. We've provided briefings, technical assistance, and training on the new guidance to local long-term care ombudsman programs and local health officers in partnership with the California Department of Public Health. We've also worked with the nursing home and assisted living professional associations on what we've done to prepare for re-entry. We've been able to secure multiple shipments of personal protective equipment from the Governor's Office of Emergency Services, for which we are greatly appreciative. That has enabled us to safely go back into facilities. We've developed training videos on donning and doffing of PPE with real live ombudsman representatives, which has been very helpful in helping our staff and volunteers feel safe and secure, and knowing that they're going into facilities in a safe manner. In addition to visits that we're making to facilities, we also are continuing to work to resolve issues via phone, online, using video conferencing. So it's a hybrid of both in-person and virtual contact with residents and facilities. As I mentioned earlier, we have started making in-person visits to facilities again since October, the beginning of our federal fiscal year. We visited more than 5,200. Well, we've made more than 5,200 facility visits since October, and you can see on the slide here the breakout between the number of facilities visited and the number of visits made in each month, October, November, and December. So a lot of good work is being done there. Next slide, please. We issued our annual report for federal fiscal year 2019 last week. It was transmitted to the governor, to the legislature, to the Administration on Aging, as well as our licensing agencies here in California. The report highlights the work of our 35 local long-term care ombudsman programs throughout the state. In federal fiscal year 19, the Ombudsman program investigated more than 36,000 complaints that affect the health, safety, welfare, and rights of residents of long-term care facilities. Problems can include, but are not limited to, issues of residents' rights or dignity, physical, verbal, mental, or financial abuse, poor quality of care, dietary concerns, medical care, therapy and rehabilitation issues, Medicare and Medi-Cal benefit issues, the improper transfer or discharge of residents, and the inappropriate use of chemical or physical restraints. The report also highlights the legislation that was supported by the Office of the State Long-Term Care Ombudsman, and it also makes recommendations on several systematic issues affecting residents of long-term care facilities. And I'd encourage you to take a look at the report. It's posted on the CDA website, and once you get the slides, you'll be able to click to download the report directly to your device. We're working right now on our annual report for federal fiscal year 20, which covers the period of October 1, 2019 through September 30th, 2020. It's certainly going to look very different from our federal fiscal year 19 report, since we were locked out of facilities from March through June of this year. Even though we were locked out, the work continued, as I said earlier, through phone contact, virtual means, video conferencing. We continued to provide services to individuals with information and assistance and other types of technical assistance to help people understand the current rules around visitation and how we could encourage family and friends to get back into facilities to visit their loved ones. So I welcome your review of the report, and would be happy to take any questions later. Thank you.
Thank you so much, Joe. Moving on, next we're going to hear from CDA's Deputy Director for Long-Term Care and Aging Services Division, Irene Walela, and Chief Deputy Director, Mark Beckley. So Irene, I believe you're up next.
Thank you, Adam. Good morning, everyone. We're going to cover a lot during this portion of the webinar, and just want to remind you that the slides are packed with information and will be available afterwards on our YouTube channel as well as website. We're going to cover 2020 data by the numbers and service highlights for meals, public information and assistance, the community-based adult services and adult day health centers program, and multi-purpose senior services program. We'll have an update on our Digital Divide Initiative activities, the Equity and Aging webinar series, and the Older Americans Act state plan. Next slide, please. We have on our website the COVID-19 response data dashboard. This provides a public display of all the weekly data that's given to us by the area agencies on aging. We continue to display the data on home delivered meals, information and assistance calls, and crisis line calls that are available by planning service area, as well as statewide aggregate. So please be sure to visit that dashboard. Next slide, please. As this slide graphically shows, a lot of energy has gone into the response to COVID-19 from CDA. The CARES Act was able to be distributed to the AAAs very quickly to the total of $59.7 million, as well as Families First Act funding of $23.8 million. That resulted in 27 million home delivered meals, 18 million resource cards mailed to older adults to give them information on where to get assistance. We fielded 741,000 information and assistance calls since April of 2020. And the Friendship Line of California, which offers behavioral health and warm line support to older Californians, has received 73,000 calls since April of 2020. Next slide. This slide is from the COVID dashboard that I referenced. Next slide, please. This slide is from the COVID dashboard that you can view at your leisure, which shows the total of 27 million meals delivered to older Californians in 2020, which was a 51% increase over the 2019 numbers. Okay, next slide. Thank you. This slide shows a picture of the resource card that was mailed out in partnership with AARP. A total of 18 million resource cards were mailed out at different points during the spring, summer, and fall. And it provided information on groceries, Medicare, medicine, community connections, and other resources, as well as additional resource connections for people using other languages other than English. Next slide, please. Here we see the telephone networks that CDA supports: the California Aging and Adult Information Line, the Friendship Line California, the Long-Term Care Ombudsman Crisis Line, and the Health Insurance Counseling and Advocacy Program. All of these phones are busy, and we provide local assistance that helps people connect with the resources that they need in those programs. The Health Insurance Counseling and Advocacy Program, for instance, provides Medicare counseling through a local high cap counselor and is available to people all over California. Friendship Line also provides 24/7 supports to people who are experiencing isolation, loneliness, and other behavioral health challenges. And it offers support in Spanish as well. Next slide, please. This slide, again, is from the COVID dashboard that you can view and shows the data as reported on all of these telephone networks. You will notice that sometimes the numbers do go up and down, but overall, that is partially due to a lag in collecting data, but you can see that there is a tremendous amount of supports being provided through our telephone networks. Next slide, please. This is specific to the Friendship Line, which has had a fairly even number of callers throughout the pandemic. And we are grateful that there is a total of 73,000 individuals who've been supported since April. This service is funded through September of 2021. Next slide. The Ombudsman crisis line also has received a great many calls, a total of 16,000 calls, which the Ombudsman programs were able to address locally. Again, we are pointing out that you can access this data on the dashboard. It is uploaded weekly. Next slide. The Health Insurance Counseling and Advocacy Program has received a total of 4,000 calls since April 6th. This provides supports to people with questions about Medicare and all other long-term care insurance. Next slide. Turning to the Community-Based Adult Services Program, also known as Adult Day Health Centers. These programs were temporarily allowed to provide alternative services by Medi-Cal, and about 35,000 people participate monthly in this program to receive telephonic, virtual, and in-home services, as well as some limited supports in the actual centers. Due to the pandemic, these temporary alternative services were approved by Medi-Cal, and the authority remains effective through March 12th, 2021, at which time it will be evaluated to determine if it will be continuing. It allows our CBAS providers to provide ongoing care to individuals who previously were coming to congregate care. Next slide. Next slide, please. The Multipurpose Senior Services Program serves over 9,000 participants monthly, and we were able to transform those services by offering telephonic or video enrollment. We had access to increased PPE supplies so that individuals could receive those critical case management and home care services from the waiver services that are authorized. The purchases for waiver service funds were expanded to include items such as antibacterial soap, disinfectant wipes, masks, and toilet paper. And of course, we want to call out that the preliminary data is showing us that the individuals who are receiving MSSP services had much less loss of life or institutionalization than pre-pandemic, and that reduced institutionalization and death continued to be reduced until just December. So the services definitely are helping people with their longevity and with being able to stay at home. And I'm going to hand it over to Mark for the digital divide information.
Thank you, Irene. On August 14th, Governor Newsom issued Executive Order N7320 to improve broadband speed and access in California. That includes improving download speeds for all Californians and to bridge the digital divide for over 2 million Californians that currently lack broadband access. The executive order specified older adults as a priority population to improve digital access. In order to bridge the digital divide, we're doing a number of things. We're conducting a needs assessment for digital adoption. That includes identifying barriers for older adults to access and use digital devices, such as identifying those geographic regions of the state that currently lack broadband access or residing in areas of the state with low broadband speeds. And then other barriers such as older adults who are unable to afford digital devices or data plans, and the need for training and support for use of devices. So we're hoping that this assessment will help us identify specific strategies and specific populations in the state that really require help to bridge the digital divide. The department currently has 2 active projects underway to bridge the digital divide. The first is the deployment of 8,500 smart speakers that have been generously donated to us by Google. 7,500 of these devices will be deployed via our local area agencies on aging, and the remaining 1,000 devices will be deployed via the state's multi-purpose senior services program, and the sites will be deployed to participants. The second project we have underway is the purchase of 4,000 iPads with 2-year data plans and dedicated customer support through an arrangement with AT&T. These devices will be deployed via the AAAs, and these devices are targeted specifically towards older adults who live alone and are low income and who live in underserved communities of the state. We're hoping that this project will result in increased feelings of inclusion and participation among individuals who receive the devices and reduce feelings of loneliness and isolation. We partnered with USC to do an evaluation of this project to see the effectiveness of the devices to increase feelings of inclusion and reduce feelings of loneliness and isolation. We have a number of other projects planned for 2021, which includes seeking opportunities for additional device donations, partnering with government, foundations, and nonprofits to expand digital access and services so that we can continue to bridge the digital divide. So more good things to come for 2021. Next slide. And we invite you to visit our Digital Divide webpage. That includes Digital Divide educational webinars, tips and tricks for using technology, and updates on CDA's Digital Divide projects. We also provide links to other resources and to other organizations that are currently working to bridge the digital divide. And at the bottom of the page, there's a link to our Digital Divide webpage. Thanks. Back to you, Irene.
Thanks, Mark. Actually, I'm going to give it to Amanda for the slide on equity and aging webinar.
Hi, good morning, everyone. Next slide, thank you. I want to invite everyone and encourage you to attend CDA's monthly webinar series called Ensuring Equity in Aging. This is a peer-led webinar series, so we invite speakers every month who represent national, state, and local organizations to share their personal lived and professional experiences to help us build a California for all ages together. So they're going to share how we can build policies and programs that are culturally competent and responsive and create programs that are welcoming of all older adults. Our next webinar is Wednesday, February 3rd. We will feature the topic culturally informed policy and programs within 4 Black elders. We have 3 fantastic speakers with such a wide breadth and depth of knowledge. They'll speak to health disparity and racial disparity data and research, chronic disease prevention, and as well as behavioral health for older adults. And if you missed that, you can't make that one, don't worry, we'll record it. We record all of our webinars. You can listen to our previous webinars, fantastic discussions around honoring Native elders, culturally informed policy and programs within for people with disabilities. And then last month we featured the culture of LGBTQ older adults. You can find all of the recordings on our Equity and Aging Resource Center page and our YouTube channel. Thanks, and back to Irene.
Thanks, Amanda. Next slide, please. So last but not least, we are working on the Older Americans Act state plan. This plan is a required report and plan for the future. that California State Unit on Aging, which is CDA, must submit to the Federal Administration for Community Living every 4 years. It's a required compliance document. It does focus primarily on the Older Americans Act programs, which are managed through the area agencies on aging. And our next state plan, our next Older Americans Act state plan, is due to the Administration for Community Living on July 1st, 2021, and will go into effect October 1, 2021. Next slide. So in our timeline, we have already accomplished a great deal. We have reviewed the local area plans received from the area agencies on aging and analyzed their plans and needs assessments during the summer and into the fall so that we could do a full comparison of what the local area plans reflect for priorities so that that would be included in the Older Americans Act state plan. We have had discussions with the members of C4A, as well as leaders from the California Commission on Aging, CWDA, and CSAC. And we are currently in the process of creating the draft document itself. We expect to post that draft plan on the CDA website so that we can seek feedback from the public and other interested parties on or before the beginning of March. And we will hold public hearings online, of course, in March so that we can have full feedback from all interested parties into the next, the plan for the next 4 years for CDA. The plan itself will be finalized from April to June, incorporating feedback from all the public and interested stakeholders, so we can submit on time by July 1st, 2021. Next slide. As I mentioned before, the Older Americans Act state plan is informed by a number of factors and will address all of these. Of course, it has to meet all statutory requirements and federal guidance. It also is aligned with the governor's recently released master plan for aging, with the California Department of Aging's new strategic plan, and all the priorities that we identified in our analysis from the 4-year local area plans from the area agencies on aging. And of course, as we've described, we will be collecting input from stakeholders and members of the public to inform the Older Americans Act state plan so that it truly represents California. And we'll be glad to answer questions later on, but for now, back to Adam.
Great, thank you so much, Irene and Mark, for those updates. Next, we're going to hear more from Amanda Lawrence, who serves as the Master Plan for Aging Project Director. And she's going to give us some updates on the recently released Master Plan for Aging.
So we are thrilled to have released the Governor's Master Plan for Aging. I'm going to go ahead and give you an overview of what you can find inside and how you can access that information. Next slide, please. So California's over 60 population is projected to grow faster than any other age group, and it's making up, it will make up about 1/4 of the population of California by 2030. And this age group is also going to become more and more diverse over time. So recognizing these demographic shifts, the governor issued an executive order back in June 2019, calling for the creation of the Master Plan for Aging to serve as a framework or a blueprint as to how we can create a state that supports all of us as we age. We released this on January 6th, just a few Wednesdays ago. It outlines 5 bold goals and 23 strategies to build a California for all ages. We had a virtual launch, and I'd like to thank Senator Melissa Hurtado and Assemblymember Adrien Nazarian and Secretary Mark Galley for joining us for that. And we shared some of these initiatives. There's a local playbook and a data dashboard. I'll go into some detail on that in a minute. You can access the Master Plan for Aging on our website. You can either view it as the webpage, you can print a report. We have two versions. We have one that's a little bit fancy with lots of colors and photos. And then we have a much more simplified one that'll be very easy on your printer. It's just text and a few charts. Next slide, please. So next slide. We have 5 bold goals for the Master Plan for Aging. And our goal 1 is housing for all ages and stages, meaning we will live where we choose as we age in communities that are age, disability, and dementia friendly and climate and disaster ready. Our target for that goal is millions of new housing options to age well. So it's more than just a house. We're talking about access to parks and recreation, transportation, climate friendliness, disaster preparedness, as well as a home that's appropriate for every stage as we age. And goal 2 is health reimagined. We will have access to the services we need to live at home in our communities and optimize our health and quality of life. Our target there is closing the equity gap and increasing life expectancy. So within this goal, you'll see strategies related to really bridging healthcare with home through innovative models, leveraged or new partnerships, as ways that we can provide supports and services to ultimately avoid unnecessary institutionalization. You'll see strategies regarding increased access to care across the spectrum, public health measures to improve population health and promote healthy aging, and some geriatric care expansion. In this goal area, you'll see our strategies related to Alzheimer's disease and dementia preparedness and planning and response, and nursing home innovation. Next slide, please. So our third goal is inclusion and equity, not isolation. By that, we mean we will have lifelong opportunities for work, volunteering, engagement, and leadership, and that will be protected from isolation, discrimination, abuse, neglect, and exploitation as we age. And our target there is to keep increasing life satisfaction as we age. You'll see strategies in this goal related to closing the digital divide that Mark just talked about in line with the governor's executive order. This has been particularly important, of course, during COVID-19 to really help older adults feel more connected with their networks, with their providers and their family and their friends. You'll also see strategies related to engagement across generations and building coordinated state leadership in aging, such as resource connections, research collaborations, and more. Goal 4 is caregiving that works. We will be prepared for and supported through the rewards and challenges of caring for aging loved ones. So in this goal, our target is 1 million high quality caregiving jobs. We want these to be good, valued jobs, well paid, with lots of professional development support. Contra Costa County's Ombudsman has a great example of this. Their Healthcare Career Pathways program is a wonderful career pipeline program. But families and friends, we often care for those in our own lives. So we also have strategies in here related to family and friend caregiving support through paid family leave and multilingual resources and support. Goal 5 is affording aging. We will have economic security for as long as we live. And our target there is to close the equity gap and increase elder economic sufficiency. Within this goal area, you'll see strategies related to ending homelessness, increasing income security as we age, and also protection for all of us from poverty and hunger as we age. Next slide, please. So implementation, moving forward. We are committed to making sure that this is not a plan that we just print out and it sits on a shelf and collects dust. This is really a continually evolving plan and vision, and we'll continually revisit it and improve upon it to drive action towards better lives for Californians of all ages. Our California, we have a cabinet work group on aging. And if you look at the plan, you'll see there are 132 initiatives within those strategies. And there's a lead agency next to each initiative because we've received commitments from across the cabinet on these initiatives that will really kickstart the master plan over the next 2 years. And then over time, the administration will issue an annual report and will determine new initiatives to span these ensuing years afterward. So please stay tuned. We're looking forward to that. And again, all those initiatives can be found on our webpage or in the report. Next slide, please. So further along that line of implementation, we'll be forming the Implementing Master Plan for Aging in California Together Impact Committee. So this committee will be made up of new stakeholder members that will be named early this year. And it will be comprised of some members who were part of our Master Plan for Aging Stakeholder Advisory Committee, but also some new members to lend some additional voices to drive this policy and program planning around priorities of the Master Plan for Aging, including long-term services and supports, equity in aging, and elder abuse and justice. Next slide, please. So that was the master plan on the state level. Next slide. So what about the local level? So we've created a local playbook, and this playbook includes 7 plays, and it's really designed for local government, communities, private and philanthropic organizations to build environments and communities that promote age-friendly and disability-friendly California. So if you go on our website, you'll find that the playbook is outlined on the website itself, but we have also created a slide deck and turned that into a PDF. So it's in a presentable form if you'd like to download that and share it with your networks. So whether you're interested in implementing one project or launching a broader vision for an age and disability friendly city or county, we hope there's something in there for you. It's really designed in a way that it's applicable to smaller projects, very focused projects, or something much broader. And we have plenty of local models highlighted in there to give you some ideas and maybe some people you can reach out to and consult with while designing your own projects and plans. Next slide, please. So we've also created our data dashboard for aging. Next slide. And this data dashboard provides a set of indicators to measure progress for each of our 5 bold goals within the master plan. We developed this dashboard in partnership with CDPH's Let's Get Healthy California team and the West Health Institute. And it really allows us to monitor the MPA's progress over 10 years, but it also offers data at the state and local level to help inform state and local planners on your own policy and program planning. So version 1.0 is available right now. We will continue to improve upon our data dashboard as new data sets become available. And of course, we're going to continue to update it as regularly as possible. And we'll continue to add new indicators. So if you visit the MPA website, there's a link up top to the dashboard. I encourage you to go ahead and check that out. Always open to hear your feedback as well. So please, you can always email us. Let us know if you think we're missing something, we should add something else. And our next slide, we will go over the virtual, next slide, please. Master Plan for Aging 5 Bold Goals Virtual Summit. This feels like it took place a very long time ago, but I believe it was last Wednesday. At this event, we were joined by Deputy Cabinet Secretary Richard Figueroa from the Governor's Office, Business Community Services Housing Agency Secretary Lourdes Castro Ramirez, Labor and Workforce Development Agency Secretary Julie Sue, Senator Scott Wiener, Assemblymember Joaquin Arambula, and CHHS Deputy Secretary Marco Meach. And with our guests, we went through each of the 5 goal areas of the Master Plan for Aging. They were, of course, joined by our director, Kim McQuay-Wade. You can read about the event and the Master Plan in the Cal Matters article. We also, of course, recorded this. It's recorded in 3 one-hour sets. It was a 3-hour summit. We wanted to dive in and make sure we covered all of those goals and talked about implementation. So please check that out. It was a really fantastic discussion and a lot of talk about what every agency secretary or assembly member or senator was excited to implement, what initiatives really they were excited to move forward. So you can find that on our YouTube page. And I'm going to hand it off, I believe now, either to Adam or Thomas for
Yep. Great. Thank you so much for that update, Amanda. Next, we're going to hear from CDA's Deputy Director of Administration on some budget and departmental updates, and that's Thomas Cameron.
Thank you, Adam. Next slide, please. Next slide. Today, I'm going to be providing an overview of the 2021 governor's budget, as well as the status of current and upcoming federal stimulus funding. We'll start with the governor's budget, which included significant new investments that will benefit California's growing and diverse aging population, and it will also help us advance the master plan for aging. Please note these proposed investments are across multiple departments within Health and Human Services Agency, including CDA. And another quick note before we move into the actual proposals, at the bottom of this slide, you will see the link to our CDA Governor's Budget Highlights document, which is located on our CDA main website under Highlights. And that can provide you a little more detail and information on the items that I'm going to go over today for you. So one of the first investments that I'm going to touch on is the statewide No Wrong Door, or Aging and Disability Resource Connection funding that was received. So the governor's budget proposes an additional investment of $7.5 million general fund in fiscal year 2021-22 and $5 million general fund in fiscal year 22-23. And the reason for the change is the $5 million in 22-23 is actually a half year of funding, because this funding actually has a suspension attached to it, dated December 31st, 2022. And finance, based on that suspension, will reassess available general fund resources in the 2022 budget processes. And if there is available resources, the ADRC additional funding will not be suspended, and these proposed resources could continue as ongoing full year funding, which would be set at $10 million per year. And just a quick note, this investment is to enable us to expand ADRC programs throughout the state. If everyone remembers, back in 2019, CDA received $5 million for the ADRC infrastructure grants to fund emerging and designated ADRCs. And this will be in addition to that. One of the next investments is the new Office of Medicare Innovation and Integration. And with this, the administration intends to submit a proposal to establish a new Office of Medicare Innovation and Integration at the Department of Healthcare Services that will explore strategies and models to strengthen and expand low and middle income Californians' access to high quality services and supports while developing new partnerships with the federal government. One of the next investments is on a bold and equitable path forward on Alzheimer's. There is a proposal for $17 million general fund, and it's one-time funding for the Department of Public Health. This proposal funds comprehensive and coordinated approach to Alzheimer's with an emphasis on communities of color and women who are disproportionately susceptible to the disease and the primary providers of caregiving. And it's going to be done via a 5-pronged approach. First is $5 million one-time investment for a public education campaign on brain health. A $4 million one-time investment for new training and certification for caregivers. Another investment of $2 million one time for expanded training and standards of care for healthcare providers. $2 million one-time funding for grants to communities so they can become dementia friendly. And lastly, $4 million one-time investment for research to strengthen California's leadership on disparities and equity in Alzheimer's. Next, we have expanded facilities to support housing, which is $250 million general fund one time for the California Department of Social Services. And this is to acquire and rehabilitate adult residential facilities and residential care facilities for the elderly, with a specific focus on preserving and expanding housing for low-income adults who are homeless or at risk of becoming homeless. Another investment at the Department of Social Services is for the IHSS COVID-19 backup provider system, and that is $3.5 million general fund one time. And what this does is it extends the backup provider wage differential to avoid disruptions to caregiving through December 2021. Please note the administration plans to evaluate the need of an IHSS provider backup system for severely impaired individuals as the state recovers from the effects of the pandemic. Another significant investment is with the Office of Statewide Health Planning and Development, and it's for increased geriatric care workforce. And it's $3 million general fund one time. And this is to grow and diversify the pipeline for the geriatric medicine workforce as the number and diversity of older adults live longer. And that requires a larger and more diverse geriatric medical workforce. One of the other significant investments is the establishment at the governor's office of a senior advisor on aging, disability, and Alzheimer's. This position will be will be helping to advance the cross-cabinet initiatives and partnerships between government, private sector, and philanthropy to address different efforts like closing the digital divide, transportation, housing, and caregiver workforce, just to name a few. And one of the last new significant investments in the governor's budget is the master plan for aging placeholder funding. $5 million general fund was set aside for spring proposals for the implementation of the master plan. And the departments and the administration will be developing those proposals during the spring budget process. Next slide, please. So on the next slide, we'll see some of the continuing investments that were included as part of the governor's budget. Please note that most of our ongoing funding for CDA programs remains stable, but does show some minor decreases from prior year. And that is due to some changes in business operations tied to COVID-19. And that's tied to things like reductions in travel or other efficiencies that we've been gaining. And that's across all state departments. So they're very minor and they don't represent any reductions to actual local participants or programs. They're actually our state level funding. So just small operations reductions to CDA's budget. So we'll start with our senior nutrition funding. One item of note is as part of the 2019 Budget Act, CDA received $17.5 million general fund for expansion of our senior nutrition program. With that, it had a suspension attached to it, much like ADRC did when I talked about it earlier. And that suspension was scheduled for December 31st of 2021. With this new governor's budget proposal, that funding remains and the suspension was actually extended by a year to December 31st, 2022. Additionally, our Older Americans Act funding for senior nutrition remains stable at $117.8 million, and that's federal and general funds combined. Next, we have supportive services and family caregiving funding. That also remains pretty stable at $61.5 million, both general fund and federal funds. Another noteworthy proposal was the reappropriation of our fall prevention program. So again, back in our 2019 budget, CDA was provided $5 million general fund one time for falls prevention pilot program. Due to the onset of the pandemic and some of the delays that has caused due to stay-at-home orders, social distancing, and other issues, some of those funds did not get fully expended. So the department received approval to reappropriate those funds, and they're now available for use by local area agencies on aging through June 30th, 2022. So our funding for our community-based adult services programs remains fairly stable at $5.8 million, and that's combined funding sources of federal and general fund. Our multi-purpose senior services programs received $23.6 million, again, pretty comparable to our prior year. And the long-term care ombudsman was funded for $17.4 million, both federal general fund and special funds, again, pretty comparable to prior year. And lastly, our health insurance counseling and advocacy program, or HICAP, was appropriated $13.6 million, again, a combination of federal and general funds, and also remains pretty stable from prior funding levels. So those are the significant governor's budget investments. And again, if you'd like to get more information on those or see more of the specifics, please refer to the link at the bottom of the page, and that'll take you to our governor's budget highlights document. And if you could go to the next slide, I'll touch on the federal stimulus, which will include the two existing federal stimulus packages, as well as the new federal stimulus package that was approved back in December. So first, just to go over a quick reminder of the federal stimulus funding we've received to date. CDA received Families First Coronavirus Response Act funding. which was 25 million, and it was for senior nutrition. To date, CDA has distributed 23.8 million to our local area agencies on aging, and 1.2 million is being used for statewide projects and initiatives. Additionally, we also received the Coronavirus Aid, Relief, and Economic Security Act funds, or CARES Act funds, as we refer to them. And we received $86.5 million through 2 rounds of CARES Act funding distributions. CDA has provided $59.6 million to our local area agencies on aging, also to our ADRCs, or our Aging and Disability Resource Connection programs, as well as to our local ombudsman. We do have a pending CARES Act Round 3 distribution to our local area agencies on aging, totaling up to potentially $17.5 million if area agencies on aging have met their expenditure and encumbrance and obligation benchmarks. So we are working to get that out in the coming weeks. And we also set aside $4.176 million for statewide projects and initiatives. And our balance post round 3 distributions of the CARES Act funding that's left for distribution to our area agencies on aging will be about $690,000. Next slide, please. So the new federal stimulus was approved on December 27th, 2020. And actually it's combined with the federal fiscal year 2021 budget. And that was approved as HR 133, or the Consolidated Appropriations Act of 2021. And this does include additional stimulus funding and relief funding for older adults. Nationally, it has $168 million for senior nutrition programs and $100 million for elder justice programs, which $50 million of that is set aside for adult protective services. And some of that will also go to local ombudsman of the remaining balance. We are still awaiting further detail on state level allocations from the Administration on Community Living, which we plan to receive likely in February, and we will be updating our website with that information as we receive it. So I'm going to move on from the budget and stimulus items to some departmental updates. I have 2 key updates regarding telework and relocation. If you can go to the next slide, please. On telework, as many departments did, CDA began teleworking in early April 2020 and continues teleworking currently. All CDA employees have been teleworking since the beginning of the pandemic, with only a very small group of employees coming into our office periodically to perform essential functions that cannot be done remotely. As part of our efforts to enable telework, CDA has implemented various new pieces of technology, Zoom, Microsoft Teams, and some other new tools around e-signatures, but we've also are working on converting our existing phone systems from an analog system to what's called a VoIP, or Voice over Internet Protocol system, which allows staff to receive and answer calls from their computers while they're working remotely. So those are 2 of the efforts we've been working on, or a few of the efforts we've been working on around telework. Another project that we have that's really exciting is the relocation of our CDA headquarters. So we are actually scheduled to move to a new facility at 2880 Gateway Oaks Drive in late summer or early fall of this year. Our new facility will address various issues. One, capacity issues for staffing. It will also address access and inclusion, and it will meet or exceed all ADA standards. It will also be a climate and environmentally friendly building, and we anticipate it will achieve LEED Commercial Interior Silver certification once construction is complete. The new facility will also have new technology and modernizations that our current facility lacks. And it will also include quite a bit more conference room and meeting space than our current facility does have. As we continue to work towards our relocation and our move, we will continue to provide additional updates and information on that. And that's all I have. Thank you.
Thank you, Tom. So in this remaining few minutes that we have, I'd like to hand it over to Director Kim McCoy-Wade for some wrap up and some closing comments.
Hi, thank you so much for all the questions and engagement. And thank you to my team, each and every one of you, for all the work you've demonstrated for the past quarter and work ahead the next quarter. I tried to respond, and I saw our team responding to as many questions as we could in the Q&A. I also just wanted to respond to 3 big themes that came up in the questions. Again, vaccine is top of mind for everybody. Lots of really important questions about access for people who are going to have trouble traveling to a site and who are in very remote locations. Internet sign up for appointments is challenging. All of that is coming in loud and clear from stakeholders, and our colleagues at CDPH at the state and local health departments are working through. I will say momentum is building. We started with just local health departments as point of access in the community. We've now added health systems as points of access. So some of you may be hearing from your systems about appointments. And then these mega sites are rolling out. So you're going to keep seeing these waves of other ways to access. We brought in the team from the census, which led California in reaching more diverse and harder to reach folks with the census to help us with thinking that too as well. So we haven't solved for that yet perfectly, but more to come, and good models are popping up all over the state. So I want to thank you for the work to break that ice. The second big question was, how do I get involved with stakeholder committees? So yes, as the master plan lays out with the 100 initiatives, there will be both new and refreshed committees to be a part of. So let me just say 2 things. The new impact committee will really be meeting a few times this year, but really is the master plan accountability, transparency, continuous improvement. Think of it as a board, if you will, a board of directors, where a lot of the real substance of the work is going to happen is at committees like the Alzheimer's Advisory, at the Olmsted Community Living Committee, at a new Elder Justice Committee, council, if you will. So we need people in all of those places. As we know, aging is everywhere. And so making sure people plug in the ADRC Advisory Committee. There are so many opportunities. So, so be open and please plug in. And we also want to bring in some new leaders and diversify and represent the whole breadth of California. So stay tuned. And the second thing I'll just say is we need just a minute on it. I'm now thinking that we can get it out by February, those different, and they'll be on a rolling basis, but I think you'll understand that we are all hands on deck on vaccine right now. So we're going to keep the momentum. There'll be those opportunities. It'll be public, but it may take us a minute as we continue to focus first and foremost on vaccines. But our commitment is this quarter to get those groups going so that we don't miss a moment. And then the third thing, lots of great questions about where is the support for a universal benefit for long-term services and supports in the master plan. And I want to just speak to this really candidly. That need that we all have to be able to afford the supports and the services we need as we age so we can live where we choose was heard loud and clear. You see it as one of the very first second goal on reimagining health and bridging health and home and the initiatives. It's right there. What you don't see is a state commitment to make it happen because we do not yet have a clarity on how we would pay for it. The DHCS Milliman study that came out this summer really went into the pros and cons of the scope of the cost to be truly inclusive and what it would take. And so there are, I think, a number of questions, particularly given this moment in our economic recovery, about how we pay for it. So the steps we're committed to take are the new Office of Medicare Innovation Integration, which really can leverage more LTSS access for the middle class through Medicare as it is, and with new opportunities at the national level, see if there's an opportunity for California national, state national partnership. This is obviously a national issue for those of you who are veterans of Class Act that we need to tackle with the feds. So that is not a punt. That is a reality statement about partnership and cost, and it remains top of mind. And welcome more stakeholder engagement by CADA and others to figure out how we get this problem solved. We have to do that. Those were the 3 big themes I saw. Adam, if you want to do a couple minutes of hand raised before we all return to vaccine work, I'd be happy to take any pressing questions. What do you see?
Sure, Maria, let's take a call or 2 if we could.
Yeah, I see 3 hands, so maybe we can do Sue, Jeffrey, and Lindsay, and then go from there.
Great, we'll start with Sue. Sue, your line has been opened. Sue DeTangelo? Okay, Sue, we'll swing back around. Jeffrey.
This is Jeff Tartagia. Two things, Kim. I've already been on the information hearing for the budget for the Senate and for the, should we say, Assembly. February 2nd is the next budget hearing. Is that going to possibly start dealing with this funding for your senior advisory position? I'm also on Kara's call right now, legislative. So we'll hopefully, what information you forward to me, I will forward to while that meeting's taking place right now. And I hope I'm not interrupting and you're not getting any feedback from me listening to two meetings again.
No, you're absolutely right, Jeffrey, and thank you for coordinating. February 2nd is the first budget hearing for CDA, and that will include, I believe that's the Senate side, if I'm remembering right this morning, and that will include the proposals that you heard Thomas Cameron walk through, including the master plan implementation and the governor's senior advisor as proposed in the January budget for that public input and legislative review and discussion. And Assembly is a little bit later in March, if I'm remembering right, 17th.
I have some dates. The last thing I will say is Kim, reach out to me because I lost my phone. So I've lost all contact with you right now, other than reestablishing again an email and the et cetera. Got some other thoughts, too, but we'll talk.
Should we do Lindsay and then?
Absolutely. Lindsay, your line is open.
Good morning. Can you hear me okay?
Yes.
Oh, wonderful. Thanks so much for all the information. And I know you're all very hard at work. I really appreciate especially the focus on COVID and the vaccine. My name's Lindsay Imai Hong. I've spoken at a few of these meetings. I'm with Hand in Hand, the Domestic Employers Network. We are a network of employers of domestic workers, including home care workers, and are part of a growing coalition that sees universal long-term services and supports as really being key to addressing so many of the big, bold goals that you've outlined in your final master plan, such as equity, economic security, and of course, being able to age and live with disability with self-determination. So appreciate that we still see in here a universal benefit. I know you just spoke to it, Kim. Want to really keep that front and center, recognize that funding is a big issue, but we've seen how in other countries, as well as even in Washington state, that they are able to tackle this with a very small payroll tax. We'd love to see it paired with something with a progressive funding source so that everyone can access it, not just those who are able to pay into a payroll tax. So wanted to thank you for keeping that in the mix and front and center as a really important goal.
Thank you. I think you get the credit in your colleagues for doing that. So thank you, and look forward to we'll figure this out.
Thank you. And Sue, it looks like you are unmuted and ready to roll, so feel free to jump in.
Thank you so much. I really appreciate Director McCoy-Wade's comments about LTSS funding. That was really where my question came from. And we look forward to working and advocating for funding in this area.
Excellent.
And it looks like our last question will be from Tatiana. Tatiana, your line has been opened.
Thank you very much. Hi. Because I wear two hats right now, I'm speaking on behalf of California Health Advocates, and Director McCoy-Wade knows us. I want to make sure that the CalAIM project also be a consideration, because definitely, as you know, it's going to impact duals. And we definitely will want to engage through one of the committees or the subcommittees, because as you know, Medicare plans are always changing. And and even there's an idea I think that I have about Medicare supplements too, because California or the states can enhance them. So I just want to ensure that you know that we will be part of one of those processes, and that CalAIM definitely has to be part of the conversation.
Yes, and I hope Tatiana and you and CHA and all who are interested, first of all, thank you for the laser focus on duals. Much appreciated.
Yes.
You are tied into their announcement of stakeholder engagement on duals and other Medicare issues and are following the CalAIM page. We're happy to help make that cross connection, but they are leading and doing so wonderfully. And so I want to make sure we help with that connection. Okay, with that, I think we packed a lot into an hour. Thanks people for their extra 10 minutes and for the questions in many different channels. You know how to find us. If you didn't get a question answered or there were some in the Q&A, Adam, I'll leave you to tell the group how we will resolve those. But thank you to everybody.
Yes. So if we were not able to get to your question, we will endeavor to do so. You may also email additional questions to olpa@aging.ca.gov. And we will also endeavor to get a archive of this meeting along with the PowerPoint posted to our YouTube page. And we will also share that link out on our social media accounts. So thanks again to everyone for being with us this morning and be well.